Hi guys. Welcome to the channel. Today, we will be discussing about theorems of retention. These were given by Richard A. Riedel. So first rule 1. Teeth moved will tend to return to the former position. In this diagram, the molar was moved mesially, but it has tendency to move back distally to its former position. Rule 2. Or theorem of retention 2 says that arch form cannot be permanently altered, especially the mandibular arch. Now the reason being is that the intercanine and intermolar width will tend to return to their formal measurements due to forces from musculature. Kaplan said that teeth can be moved or the widths can be changed but only up to a certain extent. That is within the musculature limit of the buccinator mechanism. He said that tooth movements are stable as long as they do not conflict the limits of musculature movements, that is their tolerance level. Rule 3 states that eliminating the cause of malocclusion will prevent relapse. So orthodontic treatment should always be planned around the etiology of malocclusion. For example, deleterious habits like tongue thrusting, if not treated, can cause relapse of tooth movement leading to the same malocclusion the patient had before. So, history taking is super important. Now rule number 4, malocclusion should be overcorrected. Now what does overcorrection means? Overcorrection is when we correct the malocclusion more than their normal value. To understand better, take an example of cases like deep bite cases. In such cases, we will correct the malocclusion till the overbite is 1 mm, which is overcorrection, as the normal overbite is 2 mm. Now, why is overcorrection even required or done in cases? The answer is to give some leeway for slight amount of relapse which is inevitable. This amount of relapse is one which is going to occur. Overcorrection is required especially in cases with rotations and deep bite. Rule 5 or Theorem 5 states that good occlusion is a major contributor to the retention of teeth. A good occlusion with proper interdigitation of teeth, as seen in the diagram, is really needed for stable results. This diagram depicts that a molar relation with proper cusp-fossa relation is more stable than the molar relation without it. And also one which follows all the 6 keys to normal occlusion. Now coming on to Theorem 6. It states that the bone and adjacent tissues should be given enough time so that they could adjust to the new positions. The main structures that need time are periodontal fibers and the gingival fibers. The periodontal fibers at least need 3 to 4 months for adjusting to the new position, while the gingival fibers need even more time, at least more than 6 months of retention for the stable results. Hence, one should pay more importance to the retention phase.
Next is Theorem 7, stating that upright mandibular incisors are the key to stabilization and prevention of relapse.
Tweed said that the inclination of lower incisors can help compensate for the variability in mandibular plane incisors and further helping in good retention of the correction. He stated that lower incisor inclination should be different for both vertical and horizontal growers. For horizontal growth patterns, stable results will be achieved by proclining the lower incisors to compensate for low mandibular plane angle. While in vertical growers, stability is achieved by uprighting the mandibular incisors for. Next is Rule 8, stating that corrections done during growth period is stable than the corrections achieved during adult age. And the reason behind is this, that during growth, the musculature is also growing, and with that they are able to grow around the corrections achieved during this period. This provides better stable results and less use of retention procedures. And less likely of relapsing the corrections done. And also maxillary expansion done during growing age of around 8 years provides stable and better results in the long run. Theorem or Rule 9 states that the farther the teeth are moved, the less likeliness of them to relapse back to their position. But, here the thing is, the evidences supporting this belief are not enough or are not available. Theorem 10. It states the importance of duration of the retention phase, stating that some malocclusions when corrected require permanent retention and some for short period of time. Thank you so much for watching, guys, means a lot. Bye.